I'd like to call this
Ron Gould
has joined the conference.
No, there you go.
I'd like to call this special meeting to order. This is August the 6th, and this will start out by asking the clerk of the board to do a roll call.
Supervisor Gould,
here.
Supervisor Johnson,
Here.
Supervisor Angus,
Here.
and we have Supervisor Watson and Chairman Bishop here. And then do we have County Manager Elters on the phone? Nope. Guess not yet.
Guess not. Okay,
I think Yvonne's going to come down.
okay. So our one and only agenda item this afternoon will be a report from the Public Health Director in regards to recent issues, actions, events, and county responses regarding COVID-19 and taking any necessary actions based upon those updates. So Denise Burley, the floor is yours.
Wonderful. Thank you, Madam Chair, members of the board. I'll run through the numbers to start with, as I often do. There have been a total of 3,107 cases in the county to date. As of last report, we had 1,394 that have been recovered. We only update that information on Mondays, so realizing that those numbers can change, and we'll report again on next Monday. We have 151 deaths that have occurred since this began, and we are seeing a slowing in our cases. As you've noticed in the last few days, our case counts have been lower than we've had in previous weeks, so we're cautiously optimistic that the steps that have been taken by communities to address community spread are showing some signs of progress and positive results. So hopefully we will continue to see that trend continue on into the near future and distant future as well. I wanted to cover the hospital capacity, hospital status update. I didn't see anything overly alarming within the report. I know that we continue to see HRMC, and even in this case, KRMC, sort of butting up against those capacity results for ICU beds, but they continue to kind of fall pretty steady into that range, so we're not seeing any other issues at this point. I did and have reached out to Valley View Medical Center on a number of occasions to try to get some updates on their facility. I know there have been some questions from supervisors related to that, and at this point I have not received a reply back. So I'll continue to make efforts to contact them and try to get an update on their facility. And I know they are reporting within the status update, but just some other general questions that have been asked by the board and others. So, any questions there?
Does anyone have any questions for Denise? No, ma'am.
Okay. As far as a staffing update, I wanted to inform you that we did find and recruit and hire a public health nurse to assist us in our efforts. So that was definitely positive. And we have hired one additional community health education specialist. I believe that brings us up to 11 community health education specialists, but I'll make sure that I confirm that with staff before I say that's a final number. So we have, the staff have really assisted us in getting current with our cases, especially the most recent cases, so we continue to follow up. And I'll try to have some other information available to you on that either Monday or via an email. Any questions on staffing?
I don't believe so, Denise. Thank you.
All right. So I believe on Monday I sent all of you the Arizona State Report, and I just wanted to make sure that if you had any questions about that report, that you had an opportunity to ask during the meeting. As I mentioned, from that report, it still reflects that Mojave County is in the red zone, and that is also based on cases by population each week and positivity rates of testing. So We'll have to see how that number changes over time, of course, if we continue to see our numbers decrease. Were there any questions on the report specifically that needed to be addressed or wanted to be addressed?
Does anyone have any questions?
Madam Chair,
Yes, go ahead.
my question for Ms. Burley would be, do we know why the lowering of the numbers is having to do with test results not coming back, tests not being performed?
Sure.
Or are we looking at a slowing down?
Well, Supervisor Johnson, that's a really good question. I know that last week ADHS addressed the issue of Sonora Quest and the backlog of testing still. I believe they're resolving that, and I'm not sure what the status is at this point, if they've been able to bring all of their equipment online to increase their testing capacity overall. But I believe we in this week and coming weeks, we should begin to see that turnaround time for test results shorten and that window shorten. So at this point, I don't know that we can draw any conclusions per se, but I do believe in the coming weeks we will be able to more confidently say that it's a result of the increased testing capacity.
Would you also know if the machine that we supported in getting down here in Lake Havasu, is that aided us in getting tests quicker or getting more people tested?
Well, I believe so. I believe they were working on getting that machine up and running. I believe I sent that email out on Monday. Was that correct? And their plan was to QA it on Monday and then start testing using that particular machine on Tuesday. So I know that they were going to begin that process very quickly. They were very eager, and they had already drawn up plans to begin that process anyway. So they were prepared when they got the machine.
Thank you.
Certainly. Okay. All right. Additionally, I mentioned the death report that was based on a question that Supervisor Angus had about deaths within Mojave County, and I believe I attached that to an email as well for you, and just wanted to know if there were any questions around that. And we do have, so you're aware, Mayor Schumacher, who developed this particular report, on the phone and available for questions, as I believe she can better answer many of the questions that you may have about the particular report. Additionally, she'll be able to assist in the conversation around our presentation around data and potential changes that we'll be requesting. So is there any particular questions that anybody had on the analysis of COVID deaths for Mojave County?
Madam Chair?
Supervisor Johnson?
Maybe it would be good to kind of go over what you sent us so that people who are watching might have an idea what we're talking about.
Certainly. It's a very good point, Supervisor Johnson. Mayor, do you think you could chime in and provide some overview of the report and some of the conclusions that were drawn as a result of the report?
Yes. Hi, Madam Chair, Supervisors, and Denise. This is Mayor Schumacher. I'm an epidemiologist working with Mojave County Public Health. So what I did was, Supervisor Angus had a really good question, which was, are we just really having the same amount of deaths we had in previous year, but now we're just calling it COVID instead of something else? And I thought, wow, that's a great question. I'd like to know that too. So I started digging, and I couldn't get absolutely everything we wanted for specifically Mojave County, but I was able to look at Arizona, some numbers for Arizona and some numbers for Mojave County. And what I found in a nutshell was that we have had excess deaths, it appears, due to COVID. So last year in this time period, we had about 40 deaths due to influenza pneumonia. And in the same time period this year, we've had 80 deaths due to COVID, influenza, or pneumonia. So there's definitely, no matter how you code it, no matter how you group it together, we definitely seem to be having more deaths now that COVID is present. And that really counts, that's just through June, And so if we add in July and August, when we have those data available, then I would imagine that trend is going to continue, and we're actually going to have a lot more than twice the number of how many we had last year. Thank you.
Thank you, Mayor. Were there any questions, Supervisor Angus? Since you asked that question, I didn't know if you had any other questions related to the report or that Mayor could answer for you.
So you said that, can you hear me?
Mm-hmm. Yes.
Okay.
Yes.
So am I correct that you're saying that the numbers are not just Mojave County, but were all around the state?
So I looked at numbers for Arizona because Arizona did a nice analysis combining the influenza, pneumonia, and COVID. So I looked at those numbers, but then I also looked at Mojave numbers for the number of deaths last year due to influenza and pneumonia, and then the number of deaths this year due to influenza, pneumonia, and COVID. So that I was able to look specifically at Mojave County.
Okay. All right, thank you.
Any other questions? No questions.
Okay. All right. So I'd like to move on to the reporting process. As you know, we've been reporting case information since our first case on March 24th. Initially, cases were reported individually as they trickled in, and then as the number of cases rose per day, we transitioned to a case summary at the end of each day, which includes a rolling total, and this information is utilized to inform the press releases, the daily press releases. Unfortunately, as I mentioned on Monday, a rolling total does not account for the dynamic nature of data, such as the deduplication of cases, changes in jurisdictions, cases not determined to be cases, which that does happen. And I think, Mayor, could you give a brief example of some of those instances where we have experienced duplication and movement of a case from one jurisdiction to another?
Sure. So one example would be that we have, when we want to get you the information quickly, then we run our program to count how many positive cases do we have, and we do that, we deduplicate based on a person's name and possibly their date of birth. So let's say I've got a Dennis Burley, and with a one MedSys number, MedSys is the database we use, and then I have a Denise Burley, and there's a different MedSys number. So those two people would get counted, both Dennis and Denise, a lovely couple who live at 1234 Main Street, both get counted. The next day or later in the week, when we're doing quality control or when we actually do a case investigation, we call Dennis/Denise. We find out, oh, that Dennis was a typo. It's actually Denise. And now we have the correct date of birth and address. And so that now becomes one case, whereas we counted it as two cases when we first got it out to all of you. Because we weren't counting individually. We have to count quantitatively when we have 3,000 cases. Another example would be that we'd have a case, Denise Burley, and we would count her. She's a positive case. We have a positive test for her. Then we interview her a day or two later, and we find out she lives in San Diego. That's her permanent residence. She may have come and gotten a test in Lake Havasu because she was visiting her daughter and wanted to get a test. So then that means that case is a California case. It's the county that San Diego is in. So we transfer Denise Burley out, and California, she becomes a California case. So those are two of the most common examples of where on one day we would be counting a certain person, and then a couple days later that person would no longer be in our count.
Thank you, Mayor. Public Health understands the importance of providing updates to the board, local leaders, the media, and the public in a timely manner. However, in this instance, we believe that accuracy should be the highest priority. Now that our case numbers are in the thousands, it's important for us to focus on the trends and the proposed graphs and visuals that we'll offer you today, and that offer data in a format that can be useful in making programmatic and policy decisions. We plan to transition to a new process of reporting, which will include providing one report to the board each day using an infographic report provided to you. I believe we provided a draft of that to you on Wednesday. Additionally, the county webpage will be updated to incorporate more data into the site for public view. If you can pull up the infographic up onto the screen, please. There we go. Can you all see that on your screens?
I can see mine.
Supervisor Johnson, Supervisor Angus, Supervisor Gould, can you see those? Do you have those in front of you, the infographic piece?
Not yet.
Okay.
We do now.
Okay. All right. Those will be forwarded to you right now, okay? Just to be sure you have those available for the discussion. Okay? Okay, thank you. Okay. If you could let me know when you're ready to move on to more of the discussion, I'd appreciate it, and that way I make sure that you have that open and available.
I believe we have it.
Okay, thank you. So as you can see from the infographic, it incorporates a lot of the information that we were providing before, but provides it in maybe a more visually appealing manner. We will continue to provide the confirmed cases. Hospitalizations will include let's see, Mayor, can you help me out how that was described? It was all hospitalizations?
That's any hospitalized any time during the illness, not just when we first get it. So it's a more thorough count.
Correct. Thank you. Thank you. Initially, we were just doing it at disposition when we initially learned of the case, but we realized a number of people may have started out with mild symptoms and then ended up in the hospital at a later date, and we've been able to incorporate that into our data. So what we've tried to do here is take a snapshot of information that we think would be useful and helpful, both for the public and for the media and for leadership to look at and provide in any manner that you see fit. Obviously, you can also cut and paste some of the new information off of the website, and we'll go over the website in just a moment and some of the changes that are being made in a development site for you to view. But the goal is to give you that snapshot piece to start with, and then utilize the web page for additional information and more detailed information, and draw from that particular site as well when you're looking to share information. This information that you see on the snapshot would be provided daily to you. I know there's been a question about whether or not we would make any changes for the weekends, but that was not our goal. We understand there's a desire to have this information available each day, and so that is our plan moving forward. Any questions on the infographic? keeping in mind that all of the information on this right now, as it is just fictional. It's really just so you can understand and see the format of it, and we can address any kind of questions or concerns.
Madam Chairman.
Yes, go ahead.
Denise, in that gray box on the upper left-hand corner, I'd like to see the recovered number also.
Okay.
Thank you.
Okay.
Anybody else?
Chairman Bishop, if I may add one
Yes,
thing.
Mr. Esplin, go ahead.
I was just kind of a language suggestion where it says % of cases who die.
Yes.
Yeah, cases don't die.
Right.
So I would change the language there, something else, percentage of persons who die, or number of deaths from whatever, just something else, some kind of language change there.
Certainly. Mayor, was that changed? Did we change the, I apologize.
We
but
did,
go ahead.
You'll see on the website we changed it, so take a look at that and see if you like that language. We certainly can use something else.
Okay, yes. Yes, so when we go through the web page, if that language is acceptable, then we'll use that on this particular infographic as well.
Madam Chair?
Supervisor Angus, go ahead.
In the broken down by geographic area, in the website, is it going to be broken down even further into what we get, zip codes, things like that?
We don't have it broken down by zip codes at this point in time. There are some concerns and challenges with zip code level data, and Mayor, you might be able to elaborate more on those since you've been more involved in those reports and trying to put those together. Could you describe that?
Sure, yeah. Part of it is that we get quite a few invalid zip codes, and so trying to find the correct zip codes is super time consuming. Another thing is, as you know, we can't show cells that are under 10, so we often have to put some summary type thing that says less than 10. So I think it's more helpful to look by service area. I think it's more reliable, is what I would suggest, and a lot quicker for us to do.
Okay, so back on July 23rd, I received an answer to one of my questions, and I did get a chart, cases by geographic area for Bullhead, Mojave Valley, Fort Mojave, and Golden Valley, which was perfect. But it's the only time I've ever seen this. Is that going to go in?
We can consider that option, Supervisor Angus, as a replacement for that particular chart.
I just think it's better information. It tells the story better.
Okay.
Madam Chair?
Yes, go ahead.
Going off of what Supervisor Angus said, I agree with that, because when we see bullhead numbers, we don't realize, how far out that service area might go. So it helps with the, Mojave Valley area as far as against what bullhead count is. And the same thing I think would be good if it's possible to break down the three cities, because we have diverse populations, just by mileage, so we could maybe tell if a Havasu seems to be going up, so we can figure out what they're doing, and if Bullhead's going up, maybe we can give them a little more attention, and it just helps, I think, the public understand that, hey, maybe we did good in our community for a month, and now we got relaxed and we're not wearing our mask or something, and the numbers are going up. That's all. Thank you.
Okay. Thank you for that input. Any other questions on the infographic?
Denise, is there any way to identify the service areas on the graphic of Mojave County? Maybe boundaries, can we do that?
On the second page, I know we've tried to keep this to one page, but we also recognize we wanted to provide definitions of things. So if you scroll down to the second page of that, you'll see that, and we may be able to put that information on page 2, if that would be helpful.
Yes.
Denise, I think that might only be in the website version. I'm not sure. So if it's not in this version, it's in the website version of the tech notes.
Okay. Okay. We've made some modifications, so it is on our updated version of this form, so.
I'm wondering, I think that was Supervisor Angus. Were you asking about actually the border boundaries on the graphic?
I'm sorry, repeat that?
Were you asking to see where the boundaries of each service area was on the map?
No.
Or did you
No.
want to know which communities are included in each service area?
The graphic I got was Bullhead City, Fort Mojave, Golden Valley, Kingman, Lake Havasu City, Lake Havasu County, Mojave Valley, and each city and entity was given the number, which was easy. It told the picture, and that's what I'm talking about. It was what you guys sent to me on July 23rd.
Right.
Yeah, okay, thank you. Thanks.
Okay. All right. Any other comments? We're trying to keep this one page but readable, knowing that if we make graphs and charts too small, it will become difficult for people to see. So, and we want to make sure that we provide descriptions and information on the backside of how information is calculated. Okay.
Okay, Denise, one remark, the Kingman service area is so large and so diverse. There really needs to be a way to break down the communities a little better, because, you know, from Meadview to Peach Springs, that's quite a haul.
Right.
It's
Agreed.
really unfair for the various communities that think of the Kingman service area and they just think Kingman. So somehow we need to
Figure out
develop a way to separate the various communities.
One of the challenges with that is that the number of cases in some of these smaller communities is so low that it's difficult for us to report on an individual level or on a low number level. So we want to make sure that we're comfortable with that number, and we have used a number lower than 10. We don't use numbers lower than 10. It's 0 to 10 basically during that. So what you might see if it's broken down anymore is a lot of 0 to 10s in that number. So
if at the very least, could we put that in your definitions or your descriptions on page 2?
yes, certainly. Sure. Mm-hmm. Okay, if we could move on to the website, and this is a development page that's currently sitting in the background. And we'll bring that up on the monitors. Okay. So there are significant changes, of course, to this particular site. We have county confirmed cases, and so we've tried to update the information as we've gone, and IT's been amazing during this process to work with. They've really put in a lot of time and effort, which we appreciate. The number of recovered cases and number of deaths, and of course compared to overall Arizona cases on the far right. And then if you scroll down, you will see tests performed, the positivity rate, and the tests performed and positivity rates are drawn from the ADHS website, which is where we're going to get the most accurate information. The information that we were getting from hospitals primarily and a few providers was very, it was just kind of only a part of the picture. And in order for us to really provide full, complete information, we need to use ADHS data to do that. So you'll see tests performed and positivity rate, and those tests performed, again, are only the PCR tests. Those do not count, they do not count serology testing. And then the case fatality rate, which is the number of deaths divided by the number of cases. And we've tried to put down below how we've calculated those numbers so that people can see where the data is coming from. Down below that, of course, is confirmed cases by service area again, and as well as at the addition of average age of case, and then deaths by service area, and then average age of death. And as you scroll down, you'll see that we now have some graphs available for your view. We have cases by age, and then scrolling, sorry, I don't want to make anybody sick by looking up on the monitors. I know as data moves.
Madam Chair, can she slow down a little, because we still have the original.
Oh, I'm sorry. I can absolutely slow down. Just let me know when you're ready for me to move on, Supervisor Johnson.
I have the same graph in front of me, the original one. You've put a new one up, haven't you?
So if you refresh that page, you should get the new information and the changes that have been made to that site. So the website itself hasn't changed. So if you put your cursor to the far right and just press enter, it should refresh your page.
Well, I'm looking at the one on the TV broadcast, so I'm thinking if I'm watching that and the public's watching it, they haven't probably ever seen it yet.
Okay. Would you like me to start back up at the top, Supervisor Johnson?
Maybe I'm confused, but I still have the original one that says COVID-19 in Mojave County updated August 6, 2020.
Yes, and do you see DEV to the left and right of the Coronavirus Response Hub?
I don't think so.
At the very top, I believe the link that I saw. Okay. So that's the development page side. That's to make sure that everybody's aware that that page is in development and not forward-facing to the public.
Maybe Supervisor Gould or Supervisor Angus could chime in if they're getting a better picture than I am.
Madam Chair?
Supervisor Angus, go ahead.
So, Ginny, you sent this for us, right? And
Correct.
Looking at it. And so that's where I'm not looking at it on the screen. I'm looking at it from what was sent to us, which makes it easier, I believe.
Okay.
That was for Supervisor Johnson.
That's fine then. I mean, you can go ahead. I was just watching on the screen, so I saw what the public saw.
Okay. All right. So, again, going down, we've got the county test results, PCR tests only, the confirmed cases by service area, which now includes an average age of case, and we'll continue to update that. Moving on to deaths by service area and the average age of deaths. So any questions on that particular data? Okay, all right. So if you'll scroll down below, before in our current web page, what you see is additional tables and graphs. Those tables and graphs in that particular environment are cut and paste from the reports that we're providing to the board anyway, but they don't work well on a mobile device. And so when you scroll down, you have to scroll and scroll and scroll, and there are certain challenges with how that information is presented. So IT worked with us to develop these tables, which hopefully will be a more user-friendly way to express the data, whether or not you're using a mobile phone or mobile device, or if you're on a computer. So the first tab that you see is case by age, and that would be information, again, that we provide and have provided, I believe, on our normal webpage. The second, you'll see our cases per week. So this is our epi curve. And that's, again, something that we wanted to reflect in a graph form for people to be able to visualize and see how we're progressing. Any questions so far? Okay. Cases by gender, again, a piece of information that we have provided so far. And then moving on to some of the hospital data. So this is information that we've aggregated for all of the hospitals in our county. And that is, unless the hospital provides it to us and gives us permission to provide it by hospital, this is how we can present the information to you and to the public. And then the last tab, which says DME, and we can rename that because I realize a lot of people probably are not familiar with that, but that's durable medical equipment. But if you move to that particular tab, it talks about the number of ventilators in use, number of ventilators in use for COVID-19, number that are available, and some of the data, again, that we've gone through in the past with you, but more in aggregate so the public can have a view of that as well. Any questions on that information and on the graphs?
I don't see any, Denise.
Okay, I'll keep going then. All right. The next graph down below we're doing is our death graphs, death by age group. So breaking that out based on our current criteria. And then deaths per week, of being able to show that in a graph form over time. And that's dating all the way back to our first death in the county as a result of COVID. And then deaths by gender. So, any questions on that particular table?
I do have one question, Denise. Can you explain the importance of death by gender?
Well, I think that there are individuals who are interested in knowing whether or not males or females are impacted more in deaths by COVID-19, and that's really all it's expressing.
Okay.
Madam Chair?
Supervisor Johnson, go ahead.
Is there a reason why nationwide the males seem to be higher in deaths, but in Mojave County the females are?
You know, Mayor, do you have any thoughts on that based on the data that you've seen?
I don't. I was wondering that myself, so I may try to look into that soon.
Right.
If you're interested in that.
Any other questions? So our plan to move forward is to continue our current reporting process through Saturday, which would mean you would still get a case summary up through Saturday. Sunday, we would not report, so we would need to draft something that can go out to the media and to the public to help them understand the difference and the change that's going to occur. And then starting Monday, we would provide this to you sometime in the morning and we're looking at before 11 o'clock, so our communications director will be able to get this out to the media and the information out to the media shortly thereafter and meet other deadlines.
I have a question, Madam Chair.
Okay, go ahead.
If we're going to do in the morning, if the board decides they want to go that way, we should be posting before 9 o'clock because the state does theirs at 9, and we should be similar to theirs, or there's not much point in us even putting anything out. And then I don't understand why we wouldn't do 7 days a week like everything else. The state does it.
Right. I mean, our intention at this point is to continue to provide that report out every day. Sunday is the exception in that we would be taking Sunday's information and reporting it to you on Monday. And that would be the transition to the new system.
Is that just for the one Sunday during the transition?
Correct.
Okay.
That is all.
And then it'll be 7 days a week?
That is correct.
Okay.
Correct. Yes, thank you for clarifying that. I realized that wasn't so. And Supervisor Johnson, I understand your question, and we'll regroup with our data team to just try to find a consistent time that we can provide it to you in the earliest possible time. Just want to make sure that I have their input into that to ensure that we can meet that time that we place in front of you on a consistent basis.
Okay, because the one thing that confuses me is the PAO put out a press release this morning, which should have been, I'm guessing, correct numbers, but we then received the email from the county with different numbers on it.
Correct. So the number, again, the number that's been provided in the press release has been based off that rolling total. And the number that you receive in the report in the morning is contains all of the corrections, if you will, the deduplication. It adjusts for the cases that are removed from our jurisdiction, or for that matter, added to our jurisdiction after the fact, and any other circumstances that would make our case count fluctuate day to day.
Did we get the information besides the Denise Burley object lesson that she screws up our count, of which doctors, hospitals, or labs were giving us bogus information?
We're still working on that for you, Supervisor Johnson.
All right, thank you.
You're welcome.
Okay. Do you have anything else, Denise?
I do not.
Okay, I'll open it up to any comments or questions for Denise Burley. Okay.
I have some questions, Madam Chair.
All right, go ahead, Supervisor Johnson.
Did the hospitals ever get back to you about adding COVID-19 inpatient data?
That particular information, did you say COVID-19 deaths?
No, not deaths, but like when we have
Inpatient.
ICU, yeah, so that we can see how many people are in the hospitals.
Correct. I don't believe we have access to that information. It's not in our EM resource, which is where we collect that hospital data that we report out to you. So that's not actually in that site to be able to report out.
All right. When we do our contract tracing, are we asking them their profession? It would be nice to break down on profession for folks. For example, we're seeing a lot of outbreaks among bar workers, teachers, or retirees. Is that something that's possible to do?
Mayor, could you respond to that question?
Yes, right now the question is only for specific jobs. So we asked, are you a healthcare worker or a child care worker? There are a couple others. So it's just limited to that. I think it's something we could talk about collecting. It will make the investigation a little bit longer, but I think we could consider it.
My reasoning behind it is if we're not saying that they got it from a bar and restaurant, but if all of a sudden we have 50 people from the bar and restaurant business, we could, naturally assume they're more at-risk people that, maybe, say where we have like if Havasu has numbers continue to go up and up, but we see they're mostly, like you said, teachers or restaurant and bar workers or something, we might put more emphasis on those people to, make sure they're taking care of themselves.
Okay, we'll follow up on that, Supervisor Johnson.
All right. I still have concerns about our under case investigation. Since this past Friday, we've reported 216 cases. Of those, only 17 cases are being reported to us as having complete investigation. With the additional people we've authorized, we're only seeing a 7% actually having an investigative outcome. Can you explain, is this going to change or?
Right. When we were just go ahead, Mayor, that's fine.
I can offer, if you want to go ahead, Denise, you can.
Well, I was just going to say that when cases were trickling in, we were following up with those people that day. And in those cases, we were able to report out all of the conditions that were being asked of us to report back. Now that we've got even the number of cases we are, sometimes we're not able to get to them that day, and it's that day that we've been reporting out. So that creates the under investigation and delay in reporting those. But again, just to be clear, as we learn that information, it is brought into our data sources. So what you're seeing in front of you on the website and on the infographic includes a lot of that data over time that we can include once we learn it. But Mayor, feel free to elaborate more if you have some more information you'd like to share.
Sure. Yeah, we've been really pleased with the work that the new investigators have done. They have completed, and that means they actually found someone and talked to them, about 400 investigations in 2 weeks. And then they've also contacted every single one of another 500. And when I say contacted, that means they've called them at least once, twice, or 3 times. So we're actually getting we're cutting really well into the backlog, and they're now working on newer cases. So it's looking good. The reason you don't see it in the numbers yet is because not all of the cases that they've completed are uploaded yet, or in the cases of the not remote workers, but the investigators who are here at Public Health, their information from their investigation has to be data entered, and so there's a little bit of a delay in that. So the completion rate has gone way, way, way up with the new investigators.
So we'll see something better than the 17% we've been getting?
Absolutely.
Thank you, Madam Chair.
Denise, on the website, under definitions or somewhere on the website, can you maybe indicate where people can go to the Arizona Department of Health and get the zip code reporting?
I believe up at the top, there is a link to AZDHS.gov, and that is where people can go to get the zip code level data.
Okay, I think it needs to be explained better than that, though, because normal, everyday people would not know that's,
good point.
Something needs to say zip code information available at ADHS at this link. That's a big complaint that I hear, is that in District 4, there are a number of little communities, and they want to know how they're affected. They don't really want to be attached to the Kingman numbers because they're individual communities and they have their own concerns. So
certainly,
if we could do that, I think it would be helpful.
Okay, absolutely.
Okay.
We'll work with IT on that.
Any other questions? Okay. Do you have anything further, Denise, before I close the meeting? Okay.
Oh, Madam Chair?
Yes, Supervisor Johnson, go ahead.
I like how Director Burley's trying to sneak this through, but the board was going to vote on if we were going to change our time for reporting.
Okay, I believe we would need a motion then. Are you prepared to do that?
Sure, I vote we stay exactly where we are now.
So the motion was that we stay where we are now as far as the reporting?
Yes, for evening report. I just think that going to a day report doesn't have the same impact. That's just my opinion.
Okay, we have a motion on the floor by Supervisor Johnson. Do I have a second? Okay, motion fails for lack of a second. Anything else?
Madam Chairman?
Yes, go ahead.
Can we review the reason why we're moving the evening report to a next day morning report?
Certainly.
Denise?
Certainly. So in the past, we have used that evening report for press releases, and that's created the rolling count, which does not allow us to account for the duplication of cases, the cases that are removed or added to our jurisdiction thereafter, after that particular date. So we're trying to create greater accuracy in our numbers by providing them and not using a rolling total approach. And Mayor, do you have anything you can add to that statement?
Yeah, absolutely. That would make our numbers much more accurate. I'm not sure if evening versus morning, I'm not sure if that makes a difference. I don't know.
Madam Chair?
Yes, go ahead.
I believe the greater accuracy is what we're talking about, and it's still not going to be correct whether we do it the evening or the morning. I just think that we put it out in the evening. We've been doing it that way since we started. If we put it out in the morning, I just think it dilutes what we're putting out.
So Supervisor Johnson, would it be, if I understand correctly, so please correct me if I don't, that we would use the information that we could provide you to do an evening report? That information would then still be previous day's information. So, I mean, realizing that it's always based on a 24-hour system of reporting. So, in other words, we would create a cutoff, which we do anyway, currently, of 4 o'clock or 5 o'clock in a day, and that would be when we extract the data out of the system. And then we compile that and then put it into a report form. And then our plan was to submit it the next morning. Would your thought be that we then, instead of in the morning, submit that for an evening report?
Yes, for the press release, that would go out. And then also, are we going to still, with your new formula, are we still going to have the report that the county attorney sends us every evening?
The goal was just to provide one report at the end of a day, or at some time during the day. So we were trying to move away from providing a summary report of that nature and moving into this type of reporting, which I guess, again, when we've exceeded the 3,000 cases, was really about looking at trends and looking at bigger data in a way that can help inform our actions programmatically and policies on a higher level.
My concerns are, which I've expressed to you before, are if we keep the numbers coming out, whether they're high or low, people can use that for saying, hey, what we're doing is working or what we're doing is not working. We have parents who have children they've been keeping home for 3 months now or 4 months, so they can still reinforce to them that it's still an important process that they have to go through to wear their mask or not wear their mask, whichever the case may be with those people. But I think information that we get in the evening and put out is still important. While trends are good, and I think if we use the professions to say, well, it appears that we're getting more people in Lake Havasu who, been going to bars and restaurants or whatever the case may be, or teachers, I think it gives us a chance to say, hey, those people need to take a little better care of themselves or take it a little more seriously. That's all, Madam Chair, Mr. Director.
Okay, thank you. Anyone else? Okay. I will adjourn the meeting then if there's no other comments or questions. Thank you, Denise. We're adjourned.